Hey, welcome everybody. This is Tom Judd. I'm privileged to chair the International Federation Medical Biological Engineering Clinical Engineering Division. And if you're wondering what that is, we're the biomedical engineers around the world. And welcome to this webinar. And so I'm happy to co-moderate with Leith Greenslade. Lisa, why this webinar? And good morning.
Let me start with a story, Tom. A few days ago, a young biomedical engineer from Nepal reached out to us. He's actually one of your people in Nepal. And he had been visiting his brother in a Kathmandu hospital, his brother very sick from COVID. While he was there, he noticed the oxygen wasn't working, but the hospital staff was struggling. They didn't know how to operate it. He was a biomedical engineer. He stepped in. He managed to fix the problem. His brother survived, thank goodness. But now he lives with the knowledge that if he hadn't been there at that particular time, on that particular day with those skills, perhaps his brother would not have survived. Now, how many brothers and sisters, mothers and fathers, sons and daughters are in hospital right now with COVID, not getting oxygen because the biomedical engineers are not there? So the whole purpose from the coalition, the Every Breath Counts Coalition's perspective of these 2 days are how do we mobilize the support needed so every country has the right supply of qualified biomedical engineers. Oxygen is an essential medicine, but biomedical engineers are essential healthcare workers. We need to wake the world up and invest in the biomedical engineering workforce. So we're hoping these 2 days that you generously hosted with the World Health Organization are a pivot point where we see a big shift in the way donors fund biomedical engineering and governments prioritize them.
Thank you, Leith. This is, we've got an all-star lineup you see for these 2 days. Today, talking about systems response and challenges in the oxygen space. Tomorrow about solutions from biomedical engineers. To welcome us today, we have Adriana Velazquez from WHO and Robert Mataru. And so Adriana, welcome.
Thank you. Thank you very much, Tom. Thank you for IFMB for co-organizing this workshop with Every Breath Counts. Thank you, Leith, for your words. Yes, we know Varun and we heard the story, and that's a compelling story that it touches all our hearts and our minds, and try to think how can we do things better for all patients and what is the role of biomedical engineers. And that's what I'll tell you. So the next slide, please, Kaliroy. So COVID hit the whole world, and then we have to think, what is the role of biomedical and clinical engineers to ensure that it's really to ensure that technology is appropriate to well-being of patients. And that goes everywhere, from the oxygen and intensive care, but also in the use of the protective and the design of the personal protective equipment, and all the use of the in vitro diagnostics equipment and testing, and all the medical equipment that surrounds the patient. As you all know, oxygen is an essential medicine. It helps COVID, but it also helps pneumonia. It is indispensable for surgery. It's indispensable for trauma patients, for maternal and newborn child care. So oxygen is absolutely indispensable, but it is complex. And the role of the biomedical and the clinical engineers in this area is absolutely indispensable, as per Leith's comment at the beginning of this session. Next slide, please. So the title of this session is Challenges and Solutions. So I just put 3 bullet points here. In the challenges, we need to have a medical oxygen source of good quality. It doesn't matter what it is. It could be liquid oxygen, it could be an oxygen concentrator, it could be a cylinder with oxygen, but it has to be of good quality. Then we have to ensure the distribution, the monitoring, the regulation, the pressure, the volume, everything is absolutely taken care of. And then finally, everything that we do is finally to have a patient receiving the appropriate care of safe, good quality. And the images that I put below, it is that we are developing some training material exactly on these aspects that we hope that these training videos will be launched in the next 3 weeks. In the next part of the slide, we have the solutions. So we have the technology, we need the technology. but we need the engineers to manage that technology so that then the clinical doctors can use it to their patient. It is like exactly the image that is here. If one of those parts do not work, the other one would not work and could have fatal consequences if we don't do our work well. So it is really how to engage all together as a team to make it happen. Next slide, please. Many are asking every time I tell them, go and search for your biomedical engineer, they say, well, bio what? Or where are the biomedical engineers? So for that purpose, in 2017, WHO launched this book that is called Human Resources for Medical Devices, the Role of the Biomedical Engineers. And we were mapping exactly where are those biomedical engineers. And as Liz said, yeah, the numbers are increasing. And now globally, there are more universities and more biomedical engineers around the world to help you. So please allow them to help you make the planning and the decision-making of any use of medical technologies. And we also, as Tom said, IFME has the national professional societies. There are professional societies in many countries now. So all these can be found in this book. Next slide, please. So what does this book says? Well, it says that the biomedical or the clinical engineer's role is first to design. Design is innovate. So we have to be in the innovation. We have to evaluate those equipments. We have to regulate. So regulatory authorities will have to comply that it is quality and safety. We have to plan what is needed based on the needs assessment. We have to manage the medical devices. It be from donations, procurement, technical specifications, so that then we can support local, regional, and global health. And remember always, and maybe you all know that I always say this, but it is for the benefit of the patient. It is not about technology. It's about who is receiving the benefit of the technology. Next slide, please. In WHO, we developed last year the WHO Priority Medical Devices List for COVID-19 response and associated technical specifications. Many of the people in this webinar participated to help us develop that book. So that book actually tells you for every clinical intervention, for the diagnostics, for the treatment in a healthcare center, in a district hospital, where do you need what technology? That is the table that you have on the right side. And then the square that you have on the bottom is in which level of healthcare do you have to do everything, each of these interventions. And then the technical specifications. And I really want to acknowledge that this was done in 5 months, when normally one technical specification or two might take a year. This time we did 100 technical specifications. So these specifications can now be used to do the procurement of those. And many of them are related to medical equipment for oxygen and monitoring oxygen and delivering oxygen. Next slide, please. We have for you, take three messages. So the first one is ministers of health, funding agencies, or anybody interested in this area needs to include the local biomedical engineers or other engineers, because we also have mechanical engineers, electrical engineers that need to be there to set the PSA plants, to set the liquid oxygen, to set the piping, all the engineers' perspectives to support the delivery of medical oxygen. Second point, oxygen sources and delivering technologies are complex and should include planning, the needs assessment, regulation, supply, installation, maintenance, and training for safe use. We have been hearing about a lot of accidents. Yes, these are complex technologies that need a lot of detail. And third one, what we all need to ensure is that there is good quality, availability, appropriateness, affordability to respond to the local oxygen needs, not the general, but the local needs with the local infrastructure. Next slide, please. The goal, as you all know, is that together we need to support patients and healthcare workers to have the right appropriate technology they need for the treatment of their patient. Next slide, please. And the only way we can achieve that is if together we solve local, regional, and global health problems. This, and maybe Varun is somewhere there, but we have in the almost the last row in the corner, We have Barun, that is the example that you gave, Liv. And this is the way how we all together, with all our colleagues from biomedical engineers and other colleagues from around the world, we can put solutions to this problem. Thank you very much. The last slide, please. Thank you.
Thank you, Adriana. Some great welcoming comments. And we also have Robert Mataru from Untitled. Robert?
Thank you, Tom. I'll be brief. I'm not using slides. My job alongside Adriana is just to welcome everybody and provide some framing remarks. So I'm the co-chair of the Oxygen Emergency Task Force alongside the Wellcome Trust, and you'll hear from my co-chair, Ed Whiting, tomorrow for the second webinar. Good morning, afternoon, and evening to everybody. We have a great attendance. I can see almost 126 participants on this call. Thank you for joining us today. The Oxygen Emergency Task Force, as you know, was launched at the end of February, when we started to see coming into this year some really significant and worrying surges in the needs for oxygen services and solutions in countries being impacted by COVID. The task force's purpose is to build on the really important work that was done last year in the first year of the pandemic to highlight the criticality of oxygen as a medical solution for treating severe and critically ill COVID patients, and to amplify and accelerate those solutions. So there's an important foundation of work that has been done last year and even before that for maternal and child health and for other applications. And our job is to really support partners in a complementary and coordinated way, and to corral and bring in investments and raise advocacy and awareness of this issue, but also support coordinated supply and delivery, market shaping interventions, and to link rational assessed needs that are very context specific, as we know, to financing. And we're really thankful for all the stakeholders today and tomorrow that will showcase important practices and priorities when it comes to a really critical component of end-to-end oxygen services and solutions, which is the biomedical engineering or clinical elements of that. And it's really important to invest in CapEx, but without the OpEx and the human capital, these solutions will not be properly implemented, installed, maintained, serviced, and sustained. What is critical is that all the investments that go into bolstering oxygen access as a critical medical solution during COVID is sustained beyond this pandemic for all the important reasons that we need medical oxygen before this pandemic and after it. So it's really critical that this dimension is recognized. Therefore, in the work we're doing, engaging funders, in the work we're doing in supporting countries to put in applications to funding sources like the Global Fund's COVID-19 response mechanism, we're making it very clear alongside WHO and other partners you'll hear from today like PATH and CHAI, etc., that biomedical solutions and OpEx and service and maintenance and infrastructure are really key. And not just in terms of building the capacity of the governments, of LMICs in doing this, but also supporting them and supporting technical cooperation through partners, INGOs and alike, who will also be able to support LMICs with this critical work. So thank you for that. We'll continue advocating this very strongly. Unitaid, as a development financing agency for innovation, is fully open to supporting this type of work, and will aim to convince other donors that they need to ensure financing biomedical solutions and training and capacity are also eligible financing alongside the usual things that
what will happen using.
Thank you, Robert. We're going to jump in here, folks. This is Tom. Just a quick reminder, with Leith, we'll be moderating. There's a Q&A tab for your questions. There's a chat if you'd rather. We are on Facebook Live. Tell your friends. We've got room for several hundred actually on the Zoom today, but there is a Facebook Live simultaneously, and we'll put the links for that